Welcome. My name is Joydev Das. I'm a clinician. Today, I will say a few words to you about stroke or CVA, and along with that, I will also say its types, why it happens, and what to do if it occurs. Because stroke is one of the leading causes of death and disability worldwide. First of all, what is a stroke? A stroke, also we called CVA, cerebrovascular accident, happens when the blood supply to a part of the brain is suddenly cut off, or when there is bleeding inside the brain. As results, brain cells in that area die quickly. The organs or body parts controlled by that part of the brain stop working properly or become paralyzed. Now let's come to how many types of stroke. There are mainly two types: ischemic stroke and hemorrhagic stroke. Ischemic stroke, this happen most of the time. A blood clot or plaque blocks the blood vessels and stops blood flow to the brain. Next, hemorrhagic stroke. In this situation, a blood vessels ruptures and bleeds into the brain. Actually, this type is more dangerous. I will not go into details about the two types of hemorrhagic stroke here. Now let's discuss why does stroke happen. The biggest cause is high blood pressure, and also other common causes like diabetes, smoking, high cholesterol, heart problem, obesity, unhealthy diet, and lack of exercise. So, how can you recognize if someone is having a stroke? First, observe if one side of the face is drooping, which is sometimes mistaken for Bell's palsy. Second, difficulty speaking or slurred speech. Third, sudden numbness or weakness in one arm or leg. The person has trouble raising it or cannot lift it at all. If you notice these symptoms, you can understand that the person is having a stroke. In this case, time is very important. If the patient can be taken to a hospital within 4 to 5 hours, where CT scan facilities are available, it is crucial. A CT scan is needed to determine what type of stroke has occurred. If treatment is started on time, the patient can often be fully recovered and return to normal life. You can also consult a neurologist for better management.